Okay, hey guys. So, medical stuff, definitely not my usual area of discussion. It's just usually not. But I wanted to talk about this today because I recently found an article that talks about, trans men and cancer. And this article was different than the things I'd seen in the past about trans men and cancer. Whew, sorry. Especially before I started testosterone, doing a lot of research for testosterone and all that. I had heard a lot about the possibility of testosterone increasing the risk of cancer in trans men. And like I said, I'm not like a medical expert or anything, obviously. But the last real solid, like, good reports that I had seen on testosterone, were that we really don't know the long-term effects of testosterone enough to really say for sure whether it increases the risk of cancer in trans men or not. The struggle is real with my talking right now. I don't even know. So I apologize for that. This video, it's gonna be rough. Alright. What I was trying to say is the last real reports from, good sources that I had seen on testosterone were saying that we really don't know enough about the long-term effects to really say for sure whether it increases the chance of the risk of cancer or not. The thing I liked about this article was that it talked about the risk of cancer in trans men based on what we actually do really solidly know. And that's why I really like this article, and I really think it's a good article and important for, trans men to read if you haven't really looked into this stuff already. So basically, I'll put the article in the description and you guys can check it out if you want, but I will talk about a little bit about what it talks about. I cannot find the right words at all today, so I'm so sorry about that. Basically, this article says, there is a higher risk. They've seen the higher risk of cervical, ovarian, and uterine cancer in trans men. Sorry, I'm looking at the computer screen to make sure I get this all right, because obviously these words ain't gonna come out of my head today. Now, what this article is saying, instead of blaming testosterone and all that, this article is saying that, a lot of times this is because trans men don't go and get the regular screenings as does the rest of female body population and all that. And the reasons for this are because of discrimination. They're worried about discrimination, or they have been discriminated against. It can also be very uncomfortable. A lot of dysphoria can come with that kind of examination for obvious reasons. If you're transgender, if you're a trans male, you probably know what I'm talking about if you have any kind of bottom dysphoria. And because they get misgendered when going in for those kind of examinations, and even because sometimes there are insurance issues where someone labeled as male won't be covered on insurance for that kind of procedure, even though they still have, those parts that need to be checked and stuff like that. So for those reasons, sometimes, or a lot of times, trans men won't go and get checked, and then, if they do have cancer for whatever reason, genetics or whatever, it won't be detected until the later stages, which in case it's harder to treat at that point in time. Another thing this article talks about is how studies have shown that there are a few things that can decrease a person's risk for ovarian cancer. You know, taking birth control, giving birth, breastfeeding, which trans men are all less likely to do than other female-bodied people. And because of this, their risk may be a little higher because of those reasons. So, that being said, that's why it's so important to get those examinations, and then it's kind of a double-edged sword, because then, you know, when we're facing discrimination and being misgendered and our insurance might not cover it, you know, all these things that make it so hard for us to get these examinations, when we also have this little bit higher risk, because some of these things like birth control and giving birth and breastfeeding, we're probably, a lot of us aren't doing. So, that being said, it's so important that you feel comfortable with your doctors, and you find doctors that you really feel comfortable with and who try to make you feel comfortable if you have a lot of discomfort with those kinds of examinations. And just, it's something I need to do too. I've never had one of those examinations. They recommend, you know, around 21, or unless you actually need to get something checked out, like you have pain or discomfort or anything like that. So I haven't yet, but I'm 19, you know, it's going to happen sooner rather than later. So it's something I need to look into too, but it's just so important that you feel comfortable with your doctors so that you feel like you really can go and get these checkups, because I just want everyone to stay as safe and healthy as possible. And yeah, so sorry for my whatever. I honestly, nothing, nothing. This is not working today. So I will put the link to that article in the description, and you guys can all check it out for yourself if you want, because I did a pretty bad job of explaining it. But yeah, that's basically what it says, and it's really important to get that stuff checked out. You know, make sure you find a doctor that you feel comfortable with and makes you feel comfortable. You know, you deserve that. So, you know, if any way possible, don't settle for anything less than doctors who make you feel comfortable, so that you will feel like you can go get those examinations and all that. So thank you for watching this poorly spoken video, and I will talk to you all soon. Peace.